This is Dr. Jerry Hesch, an orthopedic manual physical therapist who specializes in treating joints and treating the sacroiliac joint. I have 2 book chapters on the sacroiliac, and I have a book on the sacroiliac that's 300 pages, and have taught many workshops around the country and traveled to Europe and Canada. Anyway, my client comes from India, and he injured himself 14 years ago. He was laying on his stomach, and his friends piled up on top of him, and he felt something crunch in his low back, and has had pain ever since. That was 14 years ago. And he saw 4 different chiropractors, traveled to Melbourne, Australia from India, and got treatment for 4 months. Had physiotherapy and continues to do those exercises every single day. And came to the United States for myoskeletal alignment. He had 8 visits, and then he flew out here. And I checked his hip motion. His hip motion is full in every direction. I screened the pubic joint. It has normal alignment throughout. I do find a rather significant pelvic asymmetry, the right ASIS being considerably lower. The anterior shelf, of course, is also lower on the right side. The ASIS, that's the bump on the pelvis, is more forward on the right.
Yes, that's why I feel forward to center.
Yeah, he's aware of that, that sense of feeling like it's forward, and he's felt asymmetrical ever since that injury. You've never felt straight?
No.
Okay. What I find is that you have good posterior rotation mobility of the pelvis when we introduce it on the left side. When we try to do the same thing on the right, I'm pushing firmly and there's no movement, so I can't take up the slack. I'm doubling that force, I'm tripling that force, and there's no rotational mobility going through the right sacroiliac. He has good side-to-side motion. Okay, and let's have you lie on your stomach. He has good vertical mobility of each hemipelvis. Good sacral mobility, springing each ILA. He has good sacral spring on each quadrant of the sacrum. He has good forward bending spring motion and backward bending spring motion, pushing on the lower sacrum. Good right rotation, springing on the left side and the opposite as well, and good inferior glide. He has good inferior mobility. I'm able to spring this freely, and I can see his heels bob up and down, so the force is going through the SI joint down into the hips and into the lower extremity. On the right side, there's no motion. The slack is already taking up. I'm tripling that force, and I'm not getting any motion. Okay? Good lateral mobility on each side. Okay? And I did have him sit and bend forward, and then I did a spring test on each quadrant of the sacrum, and that mobility was good. And then I did spring testing on the spinous processes of L5 and of L4, and that mobility was good. So he presents in a very straightforward manner with what is called a right anterior ilium. And why this has escaped treatment for 14 years is, no idea. No idea why no one caught that and treated it effectively. So I'm going to mobilize it very gently. Lie on your back. Bend your right knee. And all I'm going to do is capture the sit bone, and then capture the ilium in the front, and then I'm going to rotate to an end point And I'm pushing a little bit lateral as well to gap the anterior joint, taking up all the slack. And again, my hand, my right hand is more medial because it's on the back of the ischium, and my left hand is on the anterior ilium. So now I can actually perceive motion. Do you feel that little oscillation?
Yeah, I can feel a bit slight movement.
Yeah, I feel it as well. And so I'm just going to oscillate it very gently. Now the appearance is still an asymmetry, okay? However, you'll notice I can now take up the slack, okay? And then once I take up the slack, I can spring it, and it gets an additional rotational movement of the whole pelvis, and it bounces right back, okay? So we have restored spring mobility in posterior rotation through the right side of the pelvis. And that does involve movement on both sides, actually. It involves movement of the whole pelvis. But he might have a developmental asymmetry. And I'll demonstrate how we deal with that in sitting, but let's have you lie on your stomach first, and we'll retest the other motions. Okay, so you'll recall that we were not able to spring the right ilium inferiorly, and now I can take up the slack, and now I can spring it. And I see his heel bob up and down. So the force is translating through the SI and into the hip joint and into the lower extremity. Okay? Now, he still presents, I didn't mention that he was asymmetrical at the PSIS as earlier, failed to mention that. He's still asymmetrical there, and he's still asymmetrical slightly at the iliac shelf. And so what we have is a movement dysfunction superimposed on a developmental asymmetry. Okay? And I'm now springing the ilium laterally, looking for a possible left out flare, but he has good spring mobility, so he does not have an out flare. Okay? I'm springing through the ischial tuberosity anteriorly. There's good spring mobility, so there's good pubic joint mobility. I'm springing the sacrum, and there's good rotational mobility on both sides. And I'll look at him again in sitting and make sure we don't have a sacral torsion. And I'll also test you in sideline. So let's lie on your left side. And put your legs out straight. Okay, and then just stay sideways. And so I'm springing the ilium medially on the front. And then on the back I'm capturing the ilium as well. And there's good spring mobility there as well. Okay, now lie on your back. To keep that mobility, twice a day I want you to hug this knee and hug it outside of the shoulder. Okay? Now, just for curiosity, do you feel a good stretch there?
Yeah.
Good. Good. Okay. Let's test the other side and compare sides. So take this one outside the shoulder. Feels different, doesn't it? So you have some tightness on the right side in the soft tissues that we need to address. Okay? In sitting, you feel asymmetrical, don't you? Okay, so let's have you come sit in the chair. This one over here. Bring your feet together and your knees together. Okay? So I'm suggesting that your pelvis did develop asymmetrically.
Okay.
But it did get stuck.
Mm.
Okay?
Mm.
It's now moving,
Mm.
but it's still asymmetrical. So when you sit on a chair, the chair is trying to force you into symmetry, but your pelvis isn't made symmetrical.
Mm.
In fact, this thigh, or this, because of the length of the tibia perhaps, or because of the pelvis, this is much more this is higher towards the ceiling. If I walk across, I don't even touch my other thumb. This thumb overrides my other thumb.
Mm.
Okay? And anteriorly, this appears longer.
Mm.
Okay? So what I want to do is put this foam, it's a soft foam roll, and I want to put it under your right trochanter. Okay, good. Come on that. Okay?
Mm.
And bring your knees and feet together. Okay? And you look so much more balanced now. In terms of the height of these, they look symmetrical, and the length looks much better as well.
Mm.
How do you feel?
Could I just walk around?
No, I want to know how you feel sitting.
Oh, sitting.
Yeah. How do you feel with that foam under you?
I feel, this against me, and maybe my right is like higher,
Okay.
so maybe this is like acting as that, the bridge between the seat and my bottom.
Yeah. Okay. How does
I
your
feel-
posture feel?
Can I take this?
Take it out.
Can't really say, doctor.
Can't say. Okay.
Can't
So
say.
we're going to make this an experiment. I'm going to send this with you today.
Mm.
And whenever you sit for more than 15 minutes, put it under the right side.
Mm.
Okay?
Like here. Okay.
Yeah. And see how you feel with that.
Mm.
I think it's helpful to you in sitting.
Mm.
Okay? Now put it under the other side. And that kind of exaggerates your asymmetry. How does that feel?
Can't say, doctor.
Can't say. Okay, all right. Oftentimes people feel like it worse makes their posture worse.
Yeah, I don't
But
know.
anyway, take it with you and make this an experiment.
Okay.
Okay?
Right.
And then tomorrow bring it back and let me know if you need it or not. Okay? So I'll stop filming now.